questions, and I thought, Ella, what should we do? And we agreed that a good thing to do would be provide an opportunity for our students to be able to interact directly with Dr. Willis. And so Ella Green, I'm going to start with you to ask you to say a few comments before I pass this off to Dr. Willis.
Thank you so much. Hi guys, thanks everyone for coming. My name is Ella Green, as she said, and I'm a rising senior at Redwood High School. So I wanted to share my perspective on the proposed learning plans for next year, because as of now, it appears that there's going to be a hybrid learning plan, at least in my district. Tara Topier is my district superintendent. So basically what I said to Mary Jane Burke is that the remote learning system implemented with the onset of the coronavirus was ineffective at best. Many students struggled, many weren't appearing to classes, completely disappeared from their Zoom calls, tests, assignments, and even the students who did show up weren't participating at nearly the same rate that they were before in their classes. Also, it definitely had an effect on many people's mental health. I know a lot of kids really struggled with being happy and finding themselves fulfilled during this time. On a more personal note, for me, it really affected me mentally. I think I wrote Mary Jane Burke that I'd cried more times in the first month of quarantine than in all of 2019. And I'm not saying that in hope of a pity party, but more in a realization that we need to go back to full-time in-person learning. And that's my perspective on this. And I understand coronavirus does pose a severe threat to the elderly and immunocompromised, but students suffering from health issues are generally the exception and not the rule. So a return to traditional school is absolutely necessary for the betterment of the student body.
Okay, so Ella, thank you very much. And I know that there are people on this call that have different views. Thank you to everyone who submitted questions in advance and those that are here. But what we want to do is give you all an opportunity to hear from Dr. Willis. He's going to go through a brief, some data for you. And just to note, we did ask you, if you were willing, to provide us with your name, school, and email, because what we're going to try to do is use all of you that have stepped into this space as a focus group for us. So we intend to actually keep interacting with you. So this is not intended to be a one-time interaction. And so if you give us your emails, we're going to provide additional information. And so with that, Dr. Willis, thank you very much.
Thank you, Mary Jane. And thank you, Ella. Yeah, I'm Matt Willis, Public Health Officer for the county. It's great to meet everybody. I'm also a dad of some Marin County students. My daughter graduated from Drake High School a couple of years ago, and I have a son at Drake now and another one at Wade Thomas Elementary School. And I want to just sort of offer, this context, which is, we're obviously interested in balancing risks. And as Ella said so eloquently, that, we are trying to balance the risk of COVID-19 transmission with risks we know to be associated with some of the strategies to reduce COVID-19 transmission, which is distance learning. And I'd love to invite, it's a little bit, a little challenging in the context of a Zoom call like this to really have it be interactive. Ideally, we'd be together and having the kind of back and forth dialogue that can really lead to, I think, just the best sense of kind of where people are with this. Unfortunately, one of the consequences of COVID-19 is that it's prevented us from having those in-person meetings. So we'll do our best with this format. But I also want to just promise that this is an ongoing conversation, and I'm trying to just set some of the terms of how we're navigating this, and to the degree that we can today, even have some dialogue. And Mary Jane, can you just remind me of what would be the method by which, if I have a question for the group, how we might actually get some responses? Would it be through the chat function?
Yeah, they can use the chat. I have questions that people have submitted in advance, and people could raise their hand as well. And Matt, just for you to know, Dr. Santora is also on the line.
Yay. Okay. Yay. My good friend and partner, Dr. Lisa Santora, who's a Deputy Public Health Officer from Marin County, is joining us as well. and she and I will go kind of back and forth on this. I'll start, and then Lisa can talk about some of the precautions that we're recommending as we move forward. So I'm going to actually share some slides with you, if I can navigate, so that you're not all reading my emails before I get to it. There we go. So this is something that I shared with a larger group, with some of the parents and school leaders and some of the union representatives for teachers, et cetera, around how we're navigating some of our choices. But I've modified this for you all, and really this conversation is geared towards students. You may not know kind of what a public health officer is or what we even do. So every county in the state of California has a physician health officer by statute, health and safety codes. I'm an internal medicine doctor. I practiced medicine for the first part of my career, mostly in primary care settings, and also have a degree in epidemiology. So that's the study of patterns of disease across populations. I became public health officer here in Marin 7 years ago, and this is the mission. I work for the Department of Health and Human Services, which is part of government. So my salary is paid for by taxpayers. So I'm a public servant, and and it's in that spirit that we, I think, engage in this dialogue with the public as a whole. And you as students have, your voice is really important to this. This is our mission: promote and protect the health, well-being, self-sufficiency, and safety for all in Marin. And that little word, all, is really important, I think, in terms of how we organize our strategies. It's easy to say, but it's challenging to design a system that really makes sure that everyone has the same access to the highest available standard of care across the community. This is how we, Dr. Centaur and I in the health department, define health. Many people think of health in terms of like clinical medicine and healthcare and what happens in the doctor's office. Public health, and I encourage any of you who are interested in public health to go into it. It is an awesome field. And it's partly because we get to think about well-being really holistically. So this is how the World Health Organization defines health. It's a state of complete physical, mental, and social well-being, not merely the absence of disease or infirmity. And with that definition, it already starts cueing you towards how we're approaching these decisions around COVID-19. Because if it was only the absence of disease or infirmity that we would be seeking, to do, we know how to do that. Perpetuating the shelter in place for 2 years until we develop a vaccine would be really the way we would organize ourselves societally if our only goal was the absence of disease. But we know that there would be other issues there in terms of our mental and social well-being. So we are reopening with those other values in mind. These are some of our challenges. How do we open schools in Marin County knowing that COVID-19 is part of our environment? I think it's important to ground these conversations in our values. So we value health, right? And that holistic sense of health. We value education, high quality education across all the age groups. We value equity, again, all in Marin. We value evidence and science. We value choice. We are Americans, value individual choice a lot, and that's an important part of how we're approaching this. And then we value dialogue and communication. I think that's a particular strength for Marin County, and I'm thankful for the Marin County Office of Education for bringing public health in so closely, and we really work together and engage the communities directly. Our shared challenges is that there's a lot of uncertainty ahead of us. I think from my perspective as public health officer, one of the most challenging aspects of this is not knowing what it will occur. First of all, we only have 6 months under our belts with this virus globally, just to understand the nature of the virus and its behavior. And the science is evolving every day, and we're applying that knowledge to our strategies. But also, as we forecast out, we're talking about schools coming back online in mid-August. That seems soon, and it is in some ways, especially from a planning standpoint. But from an infectious disease standpoint, really week by week, we're learning where the virus is flowing, how strong, how much the incidence is changing, as evidenced last week where we saw some increase in cases. It's a novel virus, as I said, new. There's fear. There's fear of the unknown. There's fear of what might happen if we come to school together. There's fear of what might happen if we don't. We have no zero risk options. We just have to know that right off the bat that we are all at risk, given that the virus is within the community already, and we need to be really adaptable. So this is where I'd love to, if we were together, kind of just talk this out. So this is, how do we weigh risks? So these are the risk categories I think that are relevant to all of us as we navigate these choices. We have classroom-based learning risks. So if we bring everyone back into the classrooms 5 days a week, the risks there are associated primarily with COVID-19 infection. And we need to think about risk for students, staff, and the community. And I'm going to go through some of the way we're looking at that risk in a bit. We also have risks with alternative strategies, as Ella mentioned, distance learning risks, the mental health risks, the social health risks, and the risks of equity. If our value is that everyone has an equal opportunity to thrive as a person, we know that distance learning hasn't really been, not everyone has the same opportunity to optimize what we offered in terms of technology and other distance learning tools. So, this is the question. It's like, what do you, as you think about these things, what do you think? Are there other risks that we need to be taking into account? And what can we do to limit risk in these areas, to mitigate risk, so that we might it might navigate us towards one solution or another? And I wonder if would it work to have chat responses to these now? This is kind of a new forum for me in terms of trying to have a conversation, and I think it's so valuable I love speaking with groups of people about these things. Maybe we'll try. So if you want to add to the chat any other risks that we might need to take into account, go ahead and share that, and we can discuss that. And otherwise, I can just jump into some of the data. Does that work, Mary Jane?
Yeah, absolutely.
I don't know if am I seeing? I don't see what's coming in. If you can.
Oh, sure. Okay, so here's an example. Distance learning worked fine for us and our family. Just made sure to have frequent plans with friends in a safe distance way. This keeps us feeling good with mental health. Opening isn't all or nothing. No reason to push the full opening when you could do a hybrid to address the pandemic and mental health concerns.
Okay, great.
San Rafael is a hot spot for the virus. How can we be sure that San Rafael High students are safe?
Mm-hmm.
I'd like to get a sense of what middle school will look like, cohorts, electives, what would cause a shift to distance learning, and how can we prepare for that?
Yeah.
Hoping we can have a hybrid return. My daughter does well with distance learning. So
okay.
That's from a parent. Yeah.
Okay. Yeah. Well, so we're seeing a variety of sort of responses to that. I think the questions around how to, I think it's clear to be, right up front, we need to recognize that distance learning is going to be part of the solution no matter what we do, because there will be occasions where when students, if there's students who, because of medical conditions, if their pediatrician says they're not able to safely come to school, they'll have to have distance learning options. And then if there's an occasion where there might be transmission or a case within the school, and that cohort of students, that might be closed for a period of 2 weeks, there would need to be distance learning there. So I think the strategy of sort of optimizing our ability to do effective distance learning is something from a planning standpoint we need to be moving forward with no matter what. What I'd like to do is kind of move into how we're navigating that first set of risks. I think a lot of the feedback was around that the risks or benefits of the distance learning option, which is on the other side, and then we can take them together. So these are some of the ways that we're navigating the risk of COVID-19 infection on classroom-based learning. These are some of the questions I had. Are students as easily infected as adults? What is the clinical severity of infection in students? How do school closures impact community case rates? There was a question about, Santa Fe being a hotspot. How would opening or closing schools affect that? What has been the experience of cases in schools? This is a study that was just, and I'll try and not make this too sciencey. It's actually a really relatively simple study. It was published in Nature just about 10 days ago. And they looked at as much data as they could find across the globe, data from China, Italy, Singapore, Japan, Canada, and South Korea, to look at infection rates among people of different ages with the same level of exposure, and then looked at the clinical severity among cases of different ages. And then they also modeled the impact of school closures on those community level population rates. And without getting too much into the sort of the methodology, their conclusions were that the susceptibility of infection to people under age 20 was about half of that it was for people above age 20. So this is different than what we've been talking about in terms of severity. This is actually likelihood of becoming infected for someone with a given level of exposure. So what this suggests is that younger people are, for some reason, immunologically protected against infection itself with a given level of virus exposure. And that's not surprising to find these sorts of differences by age. Every disease has a different relationship with the human immune system. We know that influenza, for example, is not like this at all. In fact, for influenza, young people are at significant risk. And some of the mortality with influenza is actually much higher among infants and young people. We're not finding that with COVID-19. There is something about the way the immune system evolves over time and as we age that makes us more and more susceptible to COVID-19 infection and disease over the age spectrum. So the second question was, how sick do children become if they become infected? And they found that 1 in 5 children, about 21% of infections in 10 to 19-year-olds rose to the level of being a clinical, that is someone who was actually sick enough to seek medical care. And the majority were people who were either mild or asymptomatic, didn't have any symptoms. As opposed to people above age 70, the vast majority of people were actually sick enough to need health care. That's an important factor just to take into account in our risk benefit. And then when we look at the cases in Marin County, we find that the proportion of people who have been hospitalized who are below age 18 is, I think we've had one individual, that's that 3% in Marin. So that global data is really, we see that echoed in our own numbers here. This was the question, how do school closures impact community case rates? And their conclusion with the school closures itself have a limited effect on population case rates. So there's a lot of things that affect how much virus is moving within our community and different sectors that come online as we think about the shelter in place. But it seems as though school closures or school openings do not have a significant impact on what we would see across the community. And it's probably related to what was shared in the first part, which is the less risk of infection among young people and less likelihood of becoming symptomatic. And that people who are asymptomatic tend to be less infectious to others. This is a crazy graphic, but I can summarize it. Basically, what these lines are each show the incidence of COVID-19 in a given nation across the globe over time, relative to when schools were open or closed. And so what you would see if at that 0 on the bottom there, which is the day that school opened within that country, and these are countries that have national, like unfortunately in the United States, there's no national strategy to address COVID-19. It's really at the local level. But in most countries, it's sort of a national strategy. So you can measure the impact of something like opening schools in terms of national prevalence. And what this shows at that 0 point is if there was a dramatic increase in transmission within that country associated with schools reopening, you would see those lines all start kind of going up after that 0 point. And what you see is more sort of just random bumping around. There's no statistical significance or no evidence that schools reopening actually changed the amount of virus that was circulating in those countries at the national level. And I'll just end with this little study that was done in Australia. They basically looked at the number of cases that were associated with any given case in a classroom or a school setting. And the little green circles there, so each of these little clusters of people represented is a classroom or a cohort of people that were exposed if someone in that setting was infected. So, and it starts with that little, at the top there, you see the little green circles. That's on the upper left, you see 2 cases were introduced into this school. And then all those other dots are those figures are those individuals that were either staff or students who came into contact with those cases. And then the red is the secondary, is the person that was infected by them. And you can see that in that first exposure, those 2 cases, there was 1 student who was infected, and the rest of the staff and students were not. And in those others, you actually see in those other cases where there was a case in the classroom or in the school, there were no other infections. So only that 1 red dot, and this was at the high school level. And then they did the same thing at the secondary school level to see that these were some staff cases who were associated with, and had contact with students and other staff. And there was 1 student total who was infected by that person. So what this shows is that, the level of infectivity or the number of secondary cases we might find in a school setting is relatively limited, especially if we're practicing those physical distancing principles. And it was taking these two studies together and what they, the implications that led us to a recommendation that we try our best in Marin County to have students come back to class as much as possible, knowing about the risks and the harms associated with distance-based learning. And again, this is something that we are just offering as a recommendation. It will be up to the schools and the school districts and your participation in those conversations to really determine what's safest and best for each setting. But that was the public health conclusion. And for the conversations that follow, again, we're setting the stage for dialogue that's going to be happening over the next few weeks. It's important to think about this too. If there are smaller numbers of cohorts if there are smaller cohorts in schools on fewer days, like the distance learning, 2 days in, 3 days out, what happens to kids who are not in school on those days, where they're at home, where they're expected to be at home? And is the assumption that one child will be at home with a parent each and every day, where they're actually online and doing that distance learning? Or are there alternatives that might occur where children might start getting together, or parents might choose to have, from a practical standpoint in terms of childcare, have other groups of children that would actually lead to more mixing of kids outside of school, so that over the course of the week, you might actually have more mixing of kids. With the decision to resume classroom learning, what's the added risk of moving it to every day? So if we're going to be on campus at least 2 or 3 days, what's the added risk of going to 5 days? That's an important consideration because the risk is already there. You have to have a system in place at the school level to make it safe at all to occur. And then finally, and I'd love everyone to be at their best thinking around this question, which is, besides distance learning, how else can we achieve the goal of fewer children in the classroom if we really want to have fewer people? Would outdoor classrooms work? Indoor learning, outdoor learning, parks? The risk for transmission is so much lower outdoors, and we've learned this now from the protests, and really not seeing significant spikes seem to be associated with people gathering out of doors and setting the protests with physical distancing and covering our faces. And so, there's a lot of opportunities, I think, for us to be much safer if we're really optimizing the outdoor space in the classroom setting. So that's just some framing for this conversation. And I'm sorry again that we're not able to make this more interactive, because I think your insights are really valuable. So let's maybe open it up to Dr. Santora. Or Mary Jane, if you want to do any
Yeah,
moderation.
how about, so just to remind everybody, there's a lot of questions coming into the chat that are obviously not from kids. So I'm going to try to cherry pick those actual comments that are coming from the students. And so I'm going to start with the 10th grader at San Marin. And there's
And
about,
Mary Jane, I'm sorry, but we're dealing with a big issue with San Quentin right now and an outbreak among inmates there.
yes,
I'm going to have to hand this off to Dr. Lisa
oh,
Santora.
okay,
Right?
all right. All right,
Lisa, are you on the line?
I'm here, so I'm ready.
Okay. Sorry. Thank you so much,
No,
everyone.
no, you're both, either one of you is great. Thank you, Lisa, welcome. So Lisa, so everyone on the call, Dr. Santora is the second in command with Dr. Willis at Public Health, and she's the person that we have also been working with since school closed, which would have been March 16th, you all remember?
13th, Friday the 13th.
Friday the 13th was the day it was announced. So anyway, Lisa, I'm going to try to answer questions that are from students. So at this point, there's several that are in this category. 10th grader, San Marin. Do we need to wear masks all day? Miller Creek School 6th grader. Will we have to wear a mask when we're outside with our friends? Can I take a break from wearing it during the day when I'm alone? Another student saying, will we have to wear masks when we're participating in sports? Let me stop there. And if you could talk about the issue of masks, when, where, how, and do I ever get a break from it?
So yes, you get a break from it. That's probably the most important answer. So face coverings are one of the most important tools that we have. I'm going to take one step back before we talk about those face coverings, but there's so much you can do to control yourself becoming infected with this virus, as well as transmitting this virus to someone else. And I'm someone that's been working since February, and so has my husband, and we've been working in nursing homes where there's been outbreaks. And there's a lot of things that we can do as a school community and individually to make sure we can, again, protect ourselves and protect others. And so the first tool that we often forget to do is just not going to school when we're not feeling well. And I know a lot of people really try and push it and get perfect attendance rates and go to school when they probably shouldn't be going to school, but to staying home when you're sick and making sure you're screening for symptoms. The second thing, and that was Dr. Willis's last slide, is the case rates are going up and we are reopening, but we really are encouraging everyone to limit their social activity. Again, the more time you spend with other people, it's going to increase your risk of getting infected with COVID-19. So even as stores are reopening and as more opportunities to go out with your friends and families, we really are encouraging people to limit your social activity and limit your physical activity. The third thing, going back to masks, the face coverings are really important for us. We are horrible at touching our face, and we probably notice it more when we're on Zoom, but we touch our face all the time. And when we touch our face, that's when the particles of virus, when we touch, let's say we rub our nose and there's a particle in there, and then we touch something else, then someone else who touches a desk or uses another item you've used and then touches themselves will introduce that virus into their system. So we have found that face coverings are really an effective way. So you stop touching your face, and that's one of the benefits of it. The second thing is that if you cough or sneeze, you're not coughing or sneezing in distance. So you'd still have your face cover on and also use respiratory etiquette like sneezing or coughing into your elbow. And again, that's another strategy. So we are recommending that students do wear a face cover when they're indoors. It is really hard. You don't see, I'm so happy when I'm in a room by myself because I'm not wearing a face cover. It's really hard to wear a face covering all day. So the extra step that we have is that if you're outside and more than 6 feet away from someone, you do not need to wear a face cover. And so I think those why Dr. Willis is really encouraging, how do we find times to maximize our time outside? And again, because you will need a break from wearing your face cover, and also just maintaining that distance. And you've probably all gotten much better at it. I have smaller kids, so they're probably not doing as well as you guys are doing, but trying to maintain that distance of 6 feet. So if you are staying 6 feet away from someone, you're wearing a face cover, you're washing your hands frequently, you're not going to get infected with COVID-19. We have a lot of control over this disease. And another question comes up and people are scared is like, well, what if I bring it into my family or bring it to my grandparents or someone one of my close family friends who might be old or have a medical condition. And again, we have the same controls. This virus is not alive. It's not breeding on us. It requires you taking the virus from someone else's mucus, basically, injecting it into your own mucus, and then letting it replicate. And so if you wash your hands all the time, if you change your clothes when you get home from school or after your sports, you'll be able to really make sure when you come back into your home environment, you're in a clean environment. So I know that was a long answer to the mask question, but I just want to get those points in.
Okay, are we able to play contact games during lunch? What are the seating arrangements going to be in classrooms? And I sit with my friends during lunch?
Those are great questions. So the first one is that we know that school just isn't the classroom time for you. There's other activities like sports and music and other things that could introduce, for example, if you're playing a trumpet, you could be introducing more and more virus in the air, or if you're singing, you can introduce virus into the air. So we're working with different parts of the school system to learn how can we do that better so we can maintain 6 feet distance. And we'll always would recommend that, especially when we're eating lunch. So when you're eating lunch, and this is when we've seen the disease really transmit quickly, is not at work. A lot of people are essential workers and they've been working this whole time. And when we see outbreaks in some of the work environments, it's because they wear their face covering when they're working, they're trying to stay 6 feet, and then they hang out at a small little table and chat within 2 feet, they take their mask off, and then they're talking. And some of you may be better, but sometimes when I talk, I spit. And so then that's the introduction of a virus in a small environment. So that's where we really are going to depend on the school site councils, because each school facility is very different. And we really are encouraging the schools districts to meet with their student councils and student leadership and think about each school uniquely and how can we know the rules. We need to wash our hands all the time. We need to maintain 6 feet distance as much as we can. And again, if you just come in with 6 feet for like a minute, that's not a great risk. It's when you spend more than 15 minutes at less than 6 feet without wearing your face cover. So looking at each school site and seeing what recommendations can we adopt as a school community to make sure we don't spread the disease among the school community.
There's a lot of worry and a lot of questions around the fact that some adults and some students won't follow the rules, that they're not going to wear the masks. Any comments about that, Dr. Willis?
So I think this is where we really are going to need students to be the role models, which we often depend on you guys for doing. And this is where we see leadership at all levels. And it's hard to do, but when you're seeing someone, and it's natural, and trust me, I remember being 16, it's natural not to want to wear the mask or want to wear the face covering, but that is how you're going to protect other people and how others will protect you as we go into this new school year. So again, I think we're going to be encouraging all of the students and all of the teachers and school staff really to take face covering very seriously. I don't think it's going to be with us for years, but we're going to have to start school. We're going to have to wear face coverings, and we're going to have to get through the flu season, because remember, there's other things circulating besides COVID-19. Why you were absent last year from school might have been you had the flu or you had strep. So we have to see how our healthcare system and our community reacts to getting through the winter season before I'm hoping in the springtime we can again look about the use of face coverings in our community. So we're going to be depending on you to role model good behavior, and depending on teachers to encourage kids to wear and students to wear their face covers. And it's hard, and I'm wearing them the right way. My kids are at camp right now. They go to Glenwood Elementary, and I go there regularly and see the mask being worn below the nose, and that's not a good thing to do either. So making sure that students, and I think a lot of schools will be looking, how do we really educate people around how to wear the face coverings the right way? And then it's hard, and I tell this all the time, in February, many of you know Dr. Willis was sick with COVID-19, and I was very close to him and I was exposed. Fortunately, I didn't get sick, but I wash my hands all of the time in March. And now I have to think all the time that I have to wash my hands more. So again, how can we work as a school community to have posters and messaging and supports just encouraging us all to engage in healthy behavior?
Okay, so I'm going to try to just see if this could work. Is Devin Grindley, are you on the line here? Devin, you signed in with your name and your school. If you're here, we want to give you a chance to ask a question. Okay, what about you, Taylor? Taylor Elliott, what about you?
I'm here.
Great.
Yeah.
What question do you have?
The question I have is for students taking any AP classes, I found that once we started distance learning, it was very ineffective and I learned very little from the time I spent learning at home. So how will students be able to fully prepare for the AP tests that they have in the spring?
So I think our first response is why we're here is really trying to find those strategies to get back in the classroom. There's different types of learners. Some of you may do really well just learning remotely, but most of us really do need to have in classroom time with teachers and to have the combination of visual learning and learning through listening to our instructors. So I think that's one of our goals is being here, because we know, and you've seen some of your friends, their graduation years were impacted, their ability to complete their own AP courses were impacted, and that's why we're here together with you to strategize how we can set you up for success to complete those AP courses and get back on what you would feel on track so you can achieve your future success. And I think it made me think of something else and I think that's going to be our challenge, and Dr. Willis mentioned it a little bit, is that the way we're designing this, there's another tool, besides all the things that I described, how you have control of not transmitting this virus, we also are going to be using a very strict measure called isolation and quarantine. So if you're in a cohort or you're in a classroom where someone does test positive, if we identify that you may have had close contact with this individual, that cohort's going to be shut down for 14 days. And so I think that's the other thing we need to prepare for, and it's been mentioned, where we do need to be prepared for distance learning, because there may be, I know there will be, it's not maybe, there will be students throughout the school year who cannot attend school because we as a public health measure have shut classrooms or a larger cohort, especially as we're looking at middle schools and high schools. In elementary schools, as you remember, they are smaller cohorts. So my kids have 25 kids in their one classroom, and we can keep them all together. But as you guys know, as you move into middle school, you're rotating through different classes, different AP classes. So the cohorts get larger, but that also means the number of students who may be out at one time in any of our secondary schools will be greater. So it's, again, something we're going to have to prepare for, that we maintain being good on Google Classroom, that we're ready in case our cohort has to close, or it is possible that a school may have to close. And those are all things that we're working now to prepare for on our side of public health. And again, working with the school districts to make sure that they're prepared for that.
Mm-hmm. George Nam, you had a question.
Yes, hello?
Hi, George.
Hi. I have to ask my question?
You can ask it, yep.
We have to change the school, or we have to stay in the same class?
You'll still be going to different classrooms based on your schedule, but we're going to be keeping a good attendance of the classroom and who's in your class. So we can find out if someone does test positive, we'll be able to tell your family that you've been exposed. And then again, you would take, if you've been exposed, you would have 14 days off. So there will be rotations of classrooms of classes in high school and in middle school. And I think what schools can look at is to see, how do we kind of narrow the group of kids that are rotating? How can we kind of create larger cohorts so that kids aren't rotating maybe as commonly as they would in years past? But again, we're going to be depending very much on the schools themselves and the districts themselves to understand some of the classes and how they might be able to structure it, so we can make the cohorts as small as possible, so we can reduce the impact if we do have to close a cohort at the high school or the middle school level. But there will be class rotations.
Great. So Joshua Chertok, what question do you have?
Hi, I actually didn't ask a question, but
I just saw you. I thought I'd ask you.
But now that I do have
You're
a
up, Joshua.
I just wanted to say thank you to you guys. I know that in the comments, a lot of people are really worried, but I just wanted to thank the doctors and the people who are working in government, because it's really stressful and yeah, it's very challenging. I don't know. I just could share my opinion. I don't think that going back to school full time personally would make me feel safe, especially since one of my parents is high risk. But I do think that for a lot of classes that are on the more challenging side, especially labs, it's really hard to do those online. But I saw a comment in the chat that I thought could be valuable to talk about, which was just like an outline of what we're thinking for everything, like sports and extracurriculars, clubs, just stuff like that. If we could hear kind of like an outline of what you guys are thinking for just like broadly.
Do you want to start with that, Mary Jane, and I can follow
Yeah,
in?
sure. So the bottom line is that things will potentially look different at different schools across the county. And there have been, and we'll make sure we send this information to you, a lot of information about what the different structures might look like. But at the middle and high school level, there will be options, at least in my view, where students will be able to go to school in as Dr. Santor described, in what we'll call smaller cohorts, so that in fact you will not be in a big giant school of 1,200, right, with 1,200 kids interacting in the same ways that you might have seen before. And so school leaders, students, teachers will be taking will be making great effort to ensure that students are not interacting with as many students as they would have typically. The number that we're looking at to try to control for is approximately 100 at the middle and high school level. So imagine that there won't be an assembly, and there won't be a big lunchtime, and there won't be a lot of students in the halls at the same time. So we'll see things that will be a lot more controlled. I want to acknowledge, though, that there will be some students who are unable to go to school because of underlying health conditions, or some students or parents that just don't feel that they're ready to have their student join, right, in school right now. So I think school districts, I know school districts are looking for a variety of different options. I'll give you one example that I'm aware of that's already in play. Imagine you're a student, and some of the students in your classes are already attending in class, and they're coming 5 days a week, but there's some that are not quite ready. That one of the models is that there's the availability of the technology in a classroom. So 3 students are attending by Zoom, by way of example, and that provides for a student to keep their whole schedule, and would also offer them an opportunity to be able to enter at a time when either their doctor thinks it's safe, or that they're ready to re-enter. So that's I think a few examples. It is definitely more complicated at the middle and high school level, because you're looking at large numbers, right, of students in most of our schools. But I want you to know that at each district level, people are currently working on what can that look like at our school. And also our state of California has enacted legislation just in the last few days that prioritizes students being able to come to school on a 5-day-a-week basis, if that is the right thing for them. So that is a priority that we're seeing in the state. I'll give you one example. In a place like Boise, Idaho, what they have identified is students are able to go to school 5 days a week, or they can choose a different option, which could be a distance learning approach. I'm not sure if any of our districts would take that as their example, but things will be evolving. One of the things that we're really lucky about in Marin is that Dr. Willis and Dr. Santoro were willing to provide, in collaboration with our school districts, the guardrails, if you will. And so I'll make sure that those of you that gave us your email will send this out to you. But essentially a 30-point plan that calls out what the guardrails are. And so these are the things that are not going to be negotiable, right? We're going to be wearing face coverings for sure. We will need to be washing our hands multiple times a day. There will be a lot of different places at the school site, whether at the time you enter or whether it's entering a classroom. It'll depend on the school for hand sanitizers. So there'll be constant ability to sort of maintain your clean hands, etc. You will be needing to check when you enter the school. There'll be questions that will be asked. In some schools, there will be actual temperature taking. Not sure, which schools will be implementing that or not. But all of this is to avoid the fact that we don't want people that are sick coming into school, and also to ensure that within the school that we're following all of the parameters that we know are the most critical. And it's pretty basic. It is hand washing, wearing the face coverings, washing your hands, and keeping yourselves at a distance. We just had information from the American Pediatric Association that came out, I think on the 25th, that identified the fact that they're actually looking at 3 feet in terms of the distancing, as opposed to 4 feet, 5 feet, or 6 feet. And that also matches with the World Health Organization. And so, as we all know, there's a lot of different information out there, and what Dr. Willis and Dr. Santoro have helped provide us is enough flexibility so that schools could reopen with students there 5 days a week, or could look at other options as a transition. So Lisa, anything to add to that?
No, and I just, yes. So I said no, but the answer is yes. I just see you guys as such an innovative group of students. And I think that's why we wanted to start this phone call and start this conversation with you, and really encourage you to be a leader at your school and bring ideas to your principal, and go to the virtual school board meetings and bring your ideas there, because you guys can problem solve in ways many adults cannot. And you know your school campus in ways that we don't know your campus. And so by sharing your ideas with your school leadership and with your school district, and part of that is going, one of the things that I'm seeing now more at the county level is that people are you guys are, are residents of this community. You might, all of you might not be old enough to vote yet, but you certainly have a voice at the school district and even at our board of supervisors. So just encouraging you to share your ideas as we reopen. You guys might have some of the best ideas about how to do this safely and how to encourage the best, us all staying on our best behavior, which is, it's going to get harder to do because it's our natural tendency to become less vigilant. But I definitely, and maybe I'm biased because I'm a mom of young kids in our own school system, but this has been a really hard time for all of you and your families. I know how challenging it has been, but I see all of you as being resilient students. I really believe that you guys are going to be part of the next greatest generation, because you see our world needing to be more equitable and more sustainable and more resilient. And I believe that you will have many of the great ideas that will help us navigate safely into the next school year. And also tell us when we need to change. And I hope you heard from Dr. Willis and I, is that we change course, we slow down and we change course. We follow data really closely. We were supposed to open up more widely on Monday, yesterday, sorry. The days all blend together. Yesterday, and then the data showed us that we had too many cases, so we needed to slow our pace a little bit. And again, that's what we remain committed to, being data driven and to listening to our community. But again, also trying to help us get back on track, because there's a lot ahead of all of you in the next couple of years, and we want to make sure you have the supportive environments that you need to be successful. But again, and the other thing that we often say, and we said it on our last phone call, if schools need to close, if there's a public health reason, because cases are going too high, that we know how to close schools. And so that we are not going to hesitate making a decision if we do think school closures are necessary. And we recognize again that the school community isn't just students under the age of 18, that the school community has staff and teachers of all different ages. And again, we are committed to making sure that we all create a healthy environment and a safe environment for everyone who walks on that campus.
Mhm. So Isabel Gray, I know you had your hand up. Could you go ahead and ask your questions?
Yes, so a lot of people I'm hearing say that what if someone in your family is at risk and you do not feel comfortable going 5 days a week? Is there going to be a choice that you don't have to go every day, that you could do maybe online school one day and go to school the next day? Or is that not a choice?
Yeah, you know, the school districts will be making the determination about what exactly the options are going to be for students. So I can't really answer that, but that will be something that the schools will, I think, will definitely address. Prior to the information that we could actually have larger cohorts of students, i.e. larger class sizes, and bring all the students back, we had been operating under the premise that the cohort size would be potentially a number like 12. And in fact, we've been operating childcare centers since March 16th, using that cohort model, as well as pilots that have operated this spring for some of our alt ed students, as well as some special ed students. And so we now have more flexibility than what would have been available for us to the cohorts of 12. And Lisa, while I'm on that, why the difference? Why all of a sudden have you moved from 12 to something more flexible as what is a typical class size, let's say a class of 25?
Right. Well, we know this disease a lot better than we did a couple of months ago. So some of the data that you saw that Dr. Willis presented, we didn't have that information on how this disease was being transmitted among the youth and pediatric populations. We didn't have the information that school openings were not a major contributor to the total population of the population spread of COVID-19 in the community. And I think that's one of the challenges that we'll always have. We're still in a very much an early learning phase about this disease. We feel much more reassured now with what we have learned and what science is showing. So for example, what Mary Jane described around reducing from 6 feet to 3 feet, the way we launch all of our public health emergency responses is to err on the side of caution. So if someone says, if you cough and it jumps, it goes, or if you sneeze and it goes 2 feet, we'll say, well, maintain 6 feet distance. If someone says it takes, you're more likely to get the disease if you spend an hour with someone, we'll say, well, only less than 15 minutes. So we are always erring on the side of caution in our early response. And that's also how we learned a lot. We had thousands of student days when we had the open the child pop-ups and child care centers, and we only had to close them around 2% of the days. And again, I think that's reassuring for us that when we create an environment that's safe, that the school staff and students can do a lot, even kids that are not good at washing their hands. We only had one student to student transmission, and it was under 5-year-old population. And if you have 5-year-olds in your family, or you remember being 5 yourself, you know that you're really not good at not touching your face and licking your fingers and eating Cheerios messily. Not only looking at that international data that Dr. Willis showed, but also looking at our own experience operating these pop-up childcare and now schools. There's classrooms that are operating right now, and we are effectively managing any potential outbreaks. And that's the other part of this, is we have a new student response team of public health nurses who are working very closely to make sure all the settings that are open right now, including some camps, have the supports that they need. One, to make sure that they're safe, and two, if there is someone that they think might have COVID, that we're helping them get tested, and making sure that we're providing the right recommendations for keeping the classroom or the camp open or closed. So
Lisa, can you stay on the line for about 10 more minutes?
of course.
Okay, great. Gracie Gonzalez.
Hi. So first of all, I want to say thank you for doing this chat for high school and middle school students. It's really informative. But my question is, in my own case, I have a chronic health condition. Like I feel it's going to be really hard in my case to personally go to in-person school. So what would that be for students that have IEPs, also in my case, that can't go to school for their own health?
And I think I'm right, but Mary Jane cut me off, but this is a special place that they've already identified medical exemptions. So where you, as part of your IEP, will make sure you have the best plan that you and your family think sets you up for success, for a successful school year. And that was already explicit in the legislation, is that there are medical exemptions can be allowed.
Right, absolutely, absolutely. Okay, what about Caden Bernstein? Sorry, I can't see the whole name. Caden? I can't hear you. Maybe you have your mute is on. Okay, I'm gonna move on, but Caden, I'll come back to you. Isabella Caballero. Sorry. Caballero. Thank you, Isabella.
Hi. First, I just wanted to thank you for holding this meeting again. It's very important, and I was wondering when we were able to communicate through the students. But my question is how are the class sizes going to be managed, especially in high school? There's limited classes, and last year I know in my AP Lang class we had 41 students in a very small classroom, and I'm just worried that classes are going to run out because our school is pretty big, but we don't have many classes offered.
Okay, you know what, I can tell by the questions that the next Zoom we need to have some people representing our high schools on the call to be able to, or middle schools, to be able to talk something like that through. 41 in a class sounds pretty large, is what I'm gonna say. Caden, are you back on?
He's on, but muted.
Still muted? Okay, Talia Harder.
Hi, thank you guys so much for reaching out to high school and middle school students. I feel like that's really important right now. My question is about equity. How are we gonna reach out to students who don't have access to internet or computers if cohorts get shut down? I don't know if we'd continue education if cohorts got shut down, but that's 2 weeks of school that you're missing. And if you have however many students missing those 2 weeks, how are we gonna reach out to students who cannot get online?
So let me take that. There's been a lot of effort in our county and in the state to ensure that the actual hotspots as well as the computers are in the hands of students. However, Talia, what we found is that even in some of those cases that students needed more support to even use the equipment. So do know that the issues around students that don't have the privilege of some other students related to where they live, who's home, whether they'll have supports necessary, are very, very significant issues for Marin County. A third of the families in our county actually make less than $600 a week. So just to give you an idea, and many of the families, parents are essential workers, just like our teachers are essential workers, working multiple jobs. And so it's been a really challenging time in particular. That's why when we started with the pilots, we tried to start with some of our students that are most vulnerable. That's also the reason why our state has identified close to $4 billion that has to be spent by December. For the purpose of trying to ensure that for those students who've had such a significant loss of learning, that we're going to be providing more opportunities. But it will be incumbent on us to ensure that when a cohort closes, that in fact students have access to what they need. And sometimes it is the computer, etc. And in some cases it will likely be other options, but we will never be in the position we were in this time. And that was March 13th, that was Friday to Monday. And you know, I want to acknowledge all of your teachers who have worked so hard during this time to try to figure out all that they could do to keep kids connected. But as someone mentioned, we have kids that we didn't hear from, kids who didn't show up. So there, it's really very, very serious. And while I'll acknowledge that for some students this worked, for many students, in fact, most of the students in the state of California, this did not work at all. Abby Alpert.
Hi. Just like everyone, thank you guys so much for doing this. But I'd heard a little bit about like possibly like a 3x3 learning plan where like the entire course load is covered in a semester or something. So I was wondering about AP classes in that, because the tests are I would assume would still be in May. So what would happen if if an AP class was first semester, I finished the course work by December, and then I had to wait 5 months to take the test?
Right. Okay, so Abby, that is something that we'll have someone connect. The next time we get on the call, I'll have one of the district leaders. Novato, I think, is looking at a 4x4 themselves or a 3x3. And so I'll have someone be able to speak about that. But I will also, when I send out information to everyone, there was actually a session that was held that was specific to that strategy. And they did address the question about what kinds of pre-testing or whatever that they'd be able to do to catch kids up. But that was definitely an issue that had been raised. I want to make sure that, just a second, Luca, are you still here, and did you have a question? Okay, I know I'll tell you this, there's still a lot of questions, obviously. We're not going to be able to keep going for that much longer. I do want to ask one of our colleagues, Emirat, are you here?
Yeah, hi.
Hi. So is it Emirat or Emrit?
Amrit is better.
Amrit, okay, Amrit, welcome. So Amrit had reached out to me and let me know that he and a colleague, another student, are actually working on an app. So Lisa, they want to tell us a little bit about it. So Amrit, let's hear it.
Yeah, so me and a friend from a Marin Academy are actually working on an app to facilitate contact tracing between cohorts to ensure like the least amount of friction as you kind of move through the school day. So it's very easy to actually report, hey, I interacted with this person outside of my cohort. And that way, if there is a positive case, you can trace it back. And the idea behind that is that way you're not de-incentivizing hanging out with your friends, right? It's just that you need to know that you did hang out with your friends. That way, if something does happen, you can kind of trace it back. And so we're currently we're just kind of testing it out a little bit. But my question is what sorts of things do we need to keep in mind as we're sort of building an application like that? Like what sorts of things do we need to ask students for in order to be able to kind of trace that back, and what sorts of data should we be asking for?
So one, just the consent, and that gets a little bit tricky, so I'll definitely make sure that the legal counsel of the school district would weigh in, but this would be absolutely something we would love to pilot. And where as I said earlier, we see you guys having a lot of solutions that we want to hear and innovate with you on. And so I would say we would probably want to pilot it at 1 or 2 schools, probably maybe one with you and your colleague, your student colleague, and then make sure we work with the council. We have a lot of power right now because it is a public health emergency, and where we some of the traditional rules around information sharing, where we still want to make sure people are informed about how we share their information. But again, to your point, we know people are going to have social activity and connect with their friends outside of their school cohort. And so to be more prepared and to be able to notify people more quickly. So what the information is, just the basics that you would think of: an email, a phone number, a name, an address, and then potentially other extracurriculars that they might be engaged in. Because we know, for example, some people will be doing sports in the fall. So we'd love to take a look at it and again, pilot it with you and see how we can use that, because testing and contact tracing have been our two keys. It's how we've been responding to outbreaks across the county. And yeah, let's take a look at it. And Mary Jane I'll put my email in the chat. You can just email me directly.
Awesome, that sounds great. Thank you.
Great. Okay, I think Lisa, I'm gonna work, so let me just say to all of you, first of all, thank you very much. This was a very short notice. We had over 200 people, I think 250 at one point, participate in this call. I'm gonna work with Ella to figure out what we think is the best next way to structure ways to get input, but we will schedule another call and try to figure that out. Ella, if you wouldn't mind putting your email in the chat so that we can get some other students who might be interested in joining. We'll make a little committee, let's say, and we'd be interested in getting a good mix of schools, etc. So if anyone is interested in being on a committee that then can work with Dr. Willis and with Dr. Santora to try to answer the questions, we will definitely commit to setting up one of these sessions that will include colleagues that are working in our high schools that would be able to not tell you how it's going to look, but rather what they're now thinking about. And so it's going to take a while between now and when school starts for our schools to figure out what they think is the right thing. And so I will, though, make sure we have people available to help support that. So with that, thank you very much to all of you who participated. We appreciate it. And if anyone's interested in working with a subgroup, we look forward to that. Lisa, I know how busy you are, and just want you to know how much we appreciate it. Very much.
We really value we value all of you. We know how hard this has been, and I'm always so impressed and amazed and inspired by you. And we're going to get through this together. There'll be bumps along the way, but we are adaptive creatures, and we will adapt to this virus, and we will be stronger because of it. And again, we're going to learn from you as much as you might have learned from Dr. Willis and myself. We are also going to learn from you on how to do this better and to keep our schools safe. So thank you for taking time during your summer to hang out with us a little bit, and we look forward to talking to you guys again soon. So thank you.
Thank you.
Also, one quick thing, anyone who wants to be involved in the next meeting, I put my email in the chat, and it's also in the spreadsheet because I'm not sure if the chat will disappear. So it's in the spreadsheet as well. So any middle or high school students that want to participate, please email me so we can get a big group of kids from all different schools so that the students really have their voices heard. So thank you again for everyone who came to this. It was a great discussion, and I appreciate how many people came. I was so surprised. I thought it would be like 40 people, and it was like 250. So that's amazing that everyone is.
Ella, you had a good idea, I guess.
Like,
okay, thanks everybody.